Hey there, this is Dr. Linda Burke, board certified OBGYN physician, blogger, and author of the Smart Mother's Guide to a Better Pregnancy. So I want to discuss briefly a case in the Baltimore Sun that piqued my interest. This case is about a 16-year-old patient named Erica Byrom, who presented to a Baltimore hospital at 25 weeks pregnant. She was informed that she had severe preeclampsia, and Ms. Byrom alleges that the hospital, it's a Johns Hopkins hospital, informed her that the baby would either be born with brain damage or die, and so she decided that she was not going to proceed with the C-section that was offered to her. 2 days later, she did deliver her baby vaginally, and unfortunately the baby did have a significant brain impairment, and she went on to sue Hopkins, and 4 years later won a jury verdict of $229 million, making history as being the highest paid malpractice case in the United States. So a couple of things definitely caught my attention. Number one, it's obvious that Ms. Byrom did not understand what preeclampsia meant, and especially severe preeclampsia, meaning that your blood pressure is 160 over 110 or even greater, because the only definitive treatment for that condition is immediate delivery of the baby, which would have meant she should have had the cesarean section. Now, I'm not sure whether Johns Hopkins, how far they went in terms of explaining her condition, but obviously there was a disconnect in terms of understanding what was going on, her understanding clinically of what was going on. The second thing that comes to mind, and this is what I want to discuss with you, my beloved audience, and please weigh in on this. Does a 16-year-old have the mental, have the maturity to make a life and death decision, which is what this turned out to be? I have to give Johns Hopkins props, because most harm in terms of preeclampsia comes from missing the diagnosis. Usually women are harmed because no one caught the diagnosis in time. In this case, the diagnosis was made at 25 weeks, and you can have preeclampsia as early as 22 weeks. So from that perspective, the physicians did their job. Anyway, thank you so much for listening. I'd love to just get your feedback. Should a 16-year-old, does a 16-year-old have the mental maturity to make a decision of this nature? Please check out my website for any additional information on preeclampsia or anything that's pregnancy related. And I look forward to seeing you next time.